Good morning, everybody, and welcome. Thanks so much for joining us. My name is Sue Peshin, and I serve as President and CEO of the Alliance for Aging Research. Today we're going to be discussing new public opinion survey results on heart valve disease, and we're also going to be discussing efforts to establish a first-ever annual National Heart Valve Disease Awareness Day that will take place on February 22nd annually. I want to start things off by thanking Edwards Life Sciences Foundation and their Every Heartbeat Matters philanthropic initiative, which provided generous support for the work we're talking about today. We could not have done this without you, so thank you very much. We will have a Q&A session at the end of the presentations. You can submit your questions at any point using the Q&A box on the right-hand side. And during the Q&A session, if you want to talk to us to ask your question, you can raise your hand virtually using the hand icon, and we will unmute you. For those of you who may not know us yet, the Alliance for Aging Research is the leading nonprofit organization dedicated to accelerating the pace of scientific discoveries in order to improve the experience of aging and health. And for 30 years now, we've been advancing innovation that supports the healthcare needs of older Americans and their family caregivers, and we do this through targeted federal advocacy and educational initiatives. We're going to start things off by talking about the burden of heart valve disease and what we've done in the past few years on this issue that led us to the survey research work and Awareness Day effort. So first of all, what is heart valve disease? More often we hear a lot about cardiovascular disease in general, but heart valve disease is a significant type of cardiovascular disease. Valve disease involves damage to one or more of the heart's valves. That can reduce blood flow, and that can cause the heart to work harder and reduce oxygen to the body. And then that can lead to a number of symptoms, including shortness of breath, weakness, dizziness, tightness in the chest, and fatigue. However, people with valve disease don't always have symptoms, even if their disease is severe. And for these people, a heart murmur is the most important clue. People with noticeable symptoms may also dismiss them, or their healthcare provider may dismiss them because they're very similar, especially in older adults, because they're very similar to normal symptoms of aging. So while not all types of valve disease are serious, some can lead to major complications, including death. And if they're left untreated, 50% of patients with severe aortic stenosis, which is a type of valve disease, won't survive 2 years. Fortunately, valve disease can usually be successfully treated with valve repair or replacement in patients of all ages, including the oldest old. And this makes early detection and diagnosis by a medical professional critical, and awareness of the disease an important tool in reducing its burden. And the health burden of heart valve disease is very high. It's estimated that more than 5 million people have heart valve disease. And the biggest risk factor for heart valve disease is increased age. More than 1 in 8 older adults aged 75 and older are estimated to have moderate to severe heart valve disease. And the death toll is also high. More than 22,000 die from HVD every year. On average, that's about 60 people every day. Because heart valve disease significantly impacts older adults, the Alliance has been involved in this issue for a number of years. We've created patient videos, brochures, community education kits, and then we created a website to house all these resources and the resources of other leading heart valve disease organizations, cardiovascular groups, cardiovascular provider organizations, and this is all designed to support and educate those affected. So we invite you to please join us at livingwithvalvedisease.org. And we recently created a new addition to the livingwithvalvedisease.org website, and it's a financial resources and care support navigator tool. The new tool is for patients and families to find financial aid and other types of assistance. On it, we're featuring organizations such as the Heart Valve Financial Aid Fund and Patient Advocate Foundation, prescription assistance programs from various companies and organizations, copay and general medical assistance, and more. Users answer questions about their specific heart valve treatment, their specific payment issues, where they live, and other demographics, and then they're presented with customized suggested resources. So we really want to spread the word on this new resource far and wide, so please link to it, help us share it, send us suggestions for who to share it with, and thank you in advance for your help on that. So all of our previous work led us to ask the following two questions. One, what is the general level of public awareness on heart valve disease? And two, who are the people who have been diagnosed with heart valve disease, and what has their experience with it been like? So to find this out, we commissioned 2 public opinion surveys from Belden Russinello strategists, and we worked closely with them to develop the survey tools. And with that, I'm going to turn things over to Nancy Belden, who serves as partner with Belden Russinello strategists, and she's the expert behind the answers to our questions. Just for a little bit of background, Nancy has conducted hundreds of research projects over 3 decades, including national public opinion polls, focus groups, and studies of elite audiences. She's authored widely used research on education, women, health, foreign policy, and the environment. Her clients have included many community, professional, and educational associations, governments, major corporations, news media, and political candidates. Previously, she was the Public Information Director for a Planned Parenthood affiliate, the Research Director for Surveys at Hill & Knowlton, and an analyst for Heart Research. Nancy's on the board of the Roper Center for Public Opinion Research. She served 3 times on the Governing Council and is a past president of the American Association for Public Opinion Research. And we're very happy to have her on the webcast today. So hi, Nancy.
Greetings. Are you hearing me?
Yes, we hear you.
Okay, I think I'm still good. I was clicking the button. So thank you all very much for having me and for supporting this research. I am looking for the place to click the slides. I'm sorry.
There should be some numbers and arrows up at the very top, Nancy. If not, I can take over.
Why don't you take over, because I have notes and that would be most helpful. Okay? So let's go to the omnibus survey methodology. Basically, which is the next slide. Can you do that? Thank you. Okay, so we did 2 surveys, and I'm going to talk about the first one, which was among the general public, to measure the awareness and familiarity of the public with heart valve disease. So we put some questions on a omnibus survey, which is one called Caravan, which we've used many times before, and interviewed 2,018 people in 2 different waves. This is a randomly selected survey that goes to both landlines and to mobile phones. So we just put a couple of questions on and go to the next slide to find out generally what do people know about this particular disease, and we can basically see that awareness is really low. About 60% told us they had heard about it. They sort of were familiar with the term, but only 9% said they knew a great deal about it. And even among people, and 15% said they knew something about it, but not very much. So really you've got that 9% who said, yeah, I'm really familiar with this. And what's particularly concerning, I suppose, is that people over 65 also are very unlikely to know very much about it. So even that population that should be the most sensitive to the possibility that they would be affected are not very familiar. So let's go to the next one. Another thing that is an issue is this fact that particularly among people of color, minorities, and low-income people, that the awareness is especially low. For example, those who say they who know a great deal or something about it, as you can see in the pie that's on the screen here, that great deal is the blue and the orange is the somewhat. That's only 24% of people, and it's even higher among African Americans and Latinos. As the sidebar tells you, 18% of African Americans, 19% of Latinos say that they know a great deal or somewhat. That compares with 26% of non-Hispanic white respondents. And again, as the second piece of that sidebar tells you, that the level of familiarity among people with low incomes is higher than it is among people with higher incomes. So, overall it's low everywhere, but particular people who are farther down the socioeconomic scale and people of color are less likely to be aware. So that gives you some clue about some of the work to be done. Now, if we look at the next slide about what we saw as far as people reporting in the survey that they had been diagnosed with heart valve disease, we found 4% overall in the general population and 9% with people among people who are 65 and older. This comported very closely with data from other sources, so that was good to know. So that's sort of what we learned from talking to the general public about what they knew. We then turned to work among patients themselves, and for this we did two things. If you want to go to the next slide, we did a survey of people who had been diagnosed with heart valve disease, and we conducted two focus groups. The survey was conducted online using an existing panel that Harris puts together, which is a really nicely done panel of people that's very, very large, which allowed us to find that 406 people, which would be a needle in the haystack otherwise. So we were very fortunate to have access to this panel. And the focus groups we used to fill out what we learned from that. We just did this in March and April of this year. So let's turn to the next slide, and let me tell you a little bit about what we found. First of all, reflecting back now to what we saw in the general public survey, most people didn't know who have been diagnosed with some form of heart valve disease knew very little about it prior to their diagnosis. If you look at the pie, you have 31% who say yes, they knew about it. Everybody else said either, I sort of knew a little bit, but I didn't really know, or they hadn't heard anything, or they can't remember. So again, referring here to the sidebar that you see there, the people with the most serious heart valve disease were a great deal more likely to be aware of it. You have 41% of them compared to 17% of people who have less serious disease, who said, yeah, actually, I already knew about this when I was diagnosed. But most concerning is that, so again, socioeconomic status really matters a lot. The lack of pre-existing awareness was higher, particularly high, among people with incomes under $50,000. It's only something like 13%. I'm sorry, it's much higher in that group, and it falls to a very low number in the top income categories. Also, something that's not on the screen here, but is further evidence of this, is education matters. People with a college degree were much more likely to say they knew something. So again, some work to be done there. Now let's look at the next panel, the next slide, about what patients told us about whether they had any idea they had something wrong when they were diagnosed. 60% were diagnosed when they went for a regular checkup. They didn't even go because they didn't go to the doctor to say, something's wrong, I'm feeling something. They were just in for something else. They went for a regular checkup. They went to have, whatever, their foot looked at, anything, and it turned out the doctor made the diagnosis, or some other healthcare provider. Women are considerably more likely to be diagnosed when they went for something else, twice as likely as men are. This is partially a function of probably of the level of seriousness of their disease, but also the higher income people. Again, we don't have it on this slide, but I think it's interesting to note that higher income people are the people who report that they felt symptoms. They went because they felt symptoms, so they went seeking advice. Compared to people who have lowest incomes, they were much more likely to not be recognizing and going to the doctor because of the symptoms, maybe for lots of reasons, I'm sure. They may go to the doctor less, but it is, again, that whole socioeconomic status issue is a concern. Next slide. The women are also less likely to be told that their heart valve disease is serious when they are seen. Men are much more likely to be told it is a major health problem. You had 46% of men when they were seen were told it was a problem, was a serious, a major health problem. Only 16% of women. Quite a difference there. Some of this is, I'm sure, explained by the actual severity of their disease, but there may be other factors there as well that we want to look carefully at and be sensitive to. Next slide. The other thing that we were interested in was the impacts that heart valve disease may have on the quality of life of patients. And we're looking here at a table, and I realize this is sort of a lot of data for a slide, so let me just walk through it and tell you what to sort of focus on. We asked people about a whole series of things that might be important to do in their lives: getting enough exercise, driving the car, taking care of their house, having a sexual relationship, working, etc. So the slide that we're looking at here is just among people who have somewhat serious disease and have been treated for it, all right? They've either gotten medicine or they've had some other sort of intervention that they've actually been treated with their valve replaced or so forth. So the sum at the top of this slide, you have 63% who had some limitation. They reported either being quite a bit or moderately impacted in one of these areas, all right, or more. This is a net of a lot of people said more than one of these areas were somewhat affected. You can see the top one, the 43%, is the most commonly recognized limitation that people had before they were treated. The 63, again, is the net of all these things. Some people reported one or more of these things were limited. That falls to 49% after they received treatment. And the most dramatic, that's the most, like conglomerating, putting them all together, we see that what that impact is. In some regards, the impact was not very, very much. If you look at the bottom of the list there, driving, taking care of themselves physically, taking part of hobbies and so forth, there wasn't an enormous amount of difference. But as far as getting exercise and going about being able to do things, go shopping, doing those things that they might want to do normally outside the home. There's some pretty big improvements there. Now, another thing that we looked at, if you want to move to the next slide, is the role of healthcare providers in all of this. And this slide shows you one particular question we asked, but we had several different questions that reflect on who diagnosed and who is important in the care and treatment of heart valve disease patients. Here you can see that we asked people about when the decision came to how to treat their illness, which of the following helped them decide about their treatment. And the very top numbers, as you can see here, is 59% is a cardiologist or a cardiac surgeon, excuse me, help them make that decision, followed by other medical doctors. Not only are the cardiologists, they are the main people in another question that we asked that help diagnose the heart valve disease, but here you see they also are the people who are really helping people make decisions about what to do. Non-medical doctors and non-medical doctors are much smaller players when it comes to that big decision. So I think it's indicative, or it's important to note that the cardiologists really have this very big role. It's not that other people, obviously, in families are not helping, not taking part, not a big part of people's lives, but this is something that people really are going to turn to cardiologists to help them decide what to do, and they're going to take advice from them. That is the final word for them. Okay, let's go to the next one. We also asked people quite a bit about we asked a question about how satisfied they were with the treatment they've received, and the level of satisfaction is enormously high. You have 78% saying they are very satisfied, another 18% somewhat. This is something that's really working out for people when they do get treatment. And this question is obviously just among people who have in fact had been treated. So it's a very, very positive finding. Next slide. We also wanted to talk to people about what might prevent them from getting treatment. And so we asked about a series of things, and people indicated which ones had been an issue for them. And I think it's interesting if you look at this slide. The smaller numbers, they're not insignificant. They are significant, but 17% said it cost too much. Related to that is the 14% saying having difficulty getting their insurance to cover it, 16% saying having difficulty getting to appointments, and 18% saying that medical facilities and doctors weren't enough near them, so it made them hard for them to get it. But the bigger things are really the sort of less tangible, just interactive things in people's lives. The top one is that 32% saying they just really didn't understand how to go about getting treated. So again, and 24% saying they didn't have family or friends that they don't feel around that can help them enough. But that 32% really suggests that difficulty in or the need for more education about this whole issue, so that people have a sense of what they should do to get treated. I think I've covered pretty much our overview of the data here, and I will pause there, and we can come back to questions whenever you want.
Okay, great. Thank you, Nancy. So now we're going to pivot over to talking about National Heart Valve Disease Awareness Day. Considering that heart valve disease affects more than 5 million Americans, and now we know that public awareness of the condition is low, and couple that with disease symptoms that are often difficult to detect or dismissed, we feel like this is a classic case of what you don't know really can hurt you. So considering that it's a very serious condition and that awareness is lacking, we decided to partner with 29 other national leading organizations to call on the U.S. Department of Health and Human Services to include National Heart Valve Disease Awareness Day, beginning annually on February 22nd, 2017, on its National Health Observances calendar. This would give it quite a bit of profile and create, a lot of reason for people to get involved in the day. And the goal of an annual National Heart Valve Disease Awareness Day on February 22nd is to increase recognition of the specific risks and symptoms of heart valve disease, to improve detection and treatment of heart valve disease, and ultimately to really help save lives. The good news is that while heart valve disease can be serious, innovative treatment that exists now can save lives and enables most patients to enjoy significant improvements in quality of life. So in this case, we believe that education and awareness has the potential to make a real tremendous difference here. So we're going to be working with our partner organizations over the coming months to help spread the word about this Awareness Day campaign, and we're going to be reaching out via traditional and social media. So if any of your organizations are interested in learning more, please send us an email, and we're going to include you in our outreach. And you can reach us at info@agingresearch.org, info@agingresearch.org. And now we're going to move actually to questions and answers to see if folks have a question that they'd like to ask. So please, feel free to submit a question if you haven't already. It looks like we do have a couple. Okay, so I'll just go with a couple of questions that we have so far. The first one is for you, Nancy, and it goes back to the satisfaction numbers, which seem very, very high. So we wanted to know what you thought that might be about, because, I think that there's sort of a question that if there is a lack of awareness, you have folks who are getting treated and then have this very high satisfaction rate. What do you think that's related to?
Thank you. I think we would have to hypothesize that it means that the treatment is actually helpful. People seem to be, whether people are getting just medicine, because some people are just being treated with medicine, and some people with more serious intervention or other intervention. It speaks to the fact that it must be the treatment that they're getting actually relieves their symptoms and helps them feel better and be more functional. I don't know that I can read any more into it than that. I don't know if somebody has some other feeling about that or theory about it.
Okay. Well, the one thought I do have, and again, we're not, I'm not a physician or anything, but one thing when we saw those results is, one of the risk factors for heart valve disease is that if you've had previous cardiovascular disease. So it could be that some of these folks were already being seen by their cardiologists, and it was caught, relatively early and taken care of relatively early. So again, this is just conjecture, and I think it would be an interesting thing to look at in further survey research, but that was one thought that came to our mind.
Well, I can also say that in the focus groups, we had two focus groups, one in New York, one in Chicago, and people talked quite passionately about the events that led up to their diagnosis and sometimes to serious episodes that they had of illness. And they were, while people aren't happy to have a life-threatening or a serious problem in their lives, the fact that there is something that they could do about it was very welcomed and passionately embraced.
Okay, great. All right, this is all really helpful, Nancy. Thank you. We got a couple of other questions here. One related to the survey again. When treatment is mentioned, is it referring to treating symptoms of valve disease or treating disease through valve replacement?
It's either one or both. We have both numbers, our question about whether or not people are have gotten medicine, been treated with medicine, and also whether they've had some other sort of intervention. So I'm looking here for the people who have gotten medicine. 39% had been prescribed medicine for their disease. 59% no. 2% couldn't remember. And then the rest of the people in the set of people answering those questions had received either valve repair or replacement surgery or transcatheter aortic valve replacement, robotics, etc. I see a question here too about did responses vary by age, and they did. There's an interesting thing in the results in that the younger people were more likely to have serious disease, to have something that we coded as more serious disease, which makes sense because they are people who noticed something serious going on and went to the doctor. It's associated as well with income. To some degree, that's because people in their under, let's say 60, 65 are still working, have higher incomes, and that plays into that whole configuration of younger, better off people are showing up in part of our more serious numbers.
Terrific. Thank you, Nancy. We do have a question about Heart Valve Disease Awareness Day. I'll go into that after our next speaker, but there was also one question about sharing the results electronically or an executive summary. And all of these materials around the survey, as well as the actual webcast itself, are going to be posted at agingresearch.org, which is our website, /valve disease, agingresearch.org/valve disease. And also information on the Awareness Day will be up there as well. So now it's actually my pleasure because she's doing this in between work, which we really appreciate, to introduce Susan Strong. Susan is a 6th grade teacher, and as many of you know, it's the first week or two at school here, so we really appreciate this. And she's also a heart valve disease survivor. Susan has decided to share her story to help others who are at risk for valve disease or seeking treatment. And she is a proud participant of the American Heart Association's Patient Ambassador Team. Thanks so much for being with us, Susan.
Well, thank you so much for having me. I'm Susan Strong, and I'm here to just provide one patient's perspective and give a story behind all of these really important statistics. My story is that I was diagnosed with Hodgkin's lymphoma in 1983. I was 17 years old, and I was treated with radiation and chemotherapy, and unfortunately, the radiation that saved my life created a difficulty, a complication 20, 30 years later, and I was diagnosed with severe aortic stenosis. I was very fortunate to be able to have TAVR, which is transcatheter aortic valve replacement, in 2014, and had very excellent results with that. And today I'm very grateful and teaching middle school full-time and leading a very active life. I just took a 3-hour hike last weekend, so doing very well. So I may not present as a typical heart valve patient in a lot of people's minds because they may think of someone who's older than I am. I'm 50, but my experience is right in line with many of the findings from the survey. I was one of the 60% that was diagnosed just going to a doctor's office for something else, and I didn't recognize the symptoms that I had, that I didn't relate them to my heart at all. So fortunately, I had a family practice provider that was aware of things and referred me on to a cardiologist, but I did not notice the symptoms. It was one of those 60%. And I had pretty low awareness about heart valve disease prior to my diagnosis. I definitely learned a lot more about it after it happened to me. And it did impact my quality of life. I was aware of the severe stenosis for a couple of years, maybe not quite that long before I actually had the TAVR, and my symptoms did continue to get worse. I had shortness of breath and had to ultimately eliminate exercising, had the chest tightness and some pain in the chest. I did definitely rely on a cardiologist in making the decision for my treatment. And the impact on my life prior to the valve replacement became quite great. I was extremely fatigued with working, and again had to stop the exercise. It was surprising, though, that prior to my diagnosis, the symptoms I didn't know at all. I just thought the shortness of breath with exercise was I wasn't in as good a shape, that my lungs had some scarring from radiation, and I had some chest tightness, and I thought that was anxiety. So it's interesting how it can be misdiagnosed by the patient, not really misdiagnosed, but misunderstood, not paying attention to the symptoms or understanding really what they are. But through it all, my treatment satisfaction is extremely high. Like I said at the beginning, was I'm able to exercise again. I feel great. Very shortly after I had TAVR and came back to work, people were remarking about just how much better I looked, and I felt so much better and had so much more energy and all. So I'm so grateful that I was able to have this treatment, and it's made a huge difference in my life, and it's been extremely meaningful to me to turn around and use this experience that I've had to help other people and give them hope, and also help educate people who might not be aware of their symptoms and the seriousness of it. So again, I'm grateful to be here today. Thank you so much for inviting me to participate in the webcast, and thank you for the work that you're doing.
Susan, thank you so much for that fabulous presentation. Now we're going to go back to questions, and Nancy, we have another question for you.
Folks wanted to know whether or not there was any data on where people get their information related to heart valve disease. Like, do they go to the web? Where do they go?
Yeah, we did have some questions on that, and we asked people whether or not they had looked for information on the Internet, and we had basically half said they had, about 47%, and they looked primarily in medical websites, some on like WebMD and the Cleveland Clinic and Mayo and so forth. They were also, we also asked them that other than the internet, what else have you done? And there were nothing is the single most likely thing. Asking that, well, I shouldn't say that. The main thing that people do is talking to a physician. They're asking their own healthcare provider. About half said that was where they looked for more information. And other than that, things are low numbers of talking to organizations, getting help from other services. What was very interesting in the focus group was the idea, and this came up in the groups that we didn't see it in the survey necessarily, was this notion that the better communicator often in the medical profession was not the doctor per se, but the nurse practitioner or a nurse or someone else in the practice who took more time with the patient. So, that's an interesting finding. Obviously, this focus group, it's just suggestive, but it made us all, and everyone who worked on this project, we all paused over that discussion because it came up several times, thinking that here on the one hand, in the quantitative data, we have this big reliance on cardiologists and internists and primary physicians. At the same time, that may be the case in its sort of big picture, but when people, I just want to be sensitive to the fact that when people get to the physician's office, it's not always the talking that's really helpful to them. It's not always that physician. Sometimes it's and maybe often it's somebody else. So I think that's another thing that we probably want to be sensitive to and think about looking at more carefully in the future.
Right. I actually have a question for you, Nancy. I know you did some interesting focus groups in a couple of cities, and I thought, the audience listening might be interested to hear a bit more about those.
Well, we did sort of the classic groups, so they were about 10 people in each group, recruited by the focus group facilities that we used in those places. They reached out to all kinds of ways to find people. Any of you who have been involved in focus groups know that focus group facilities keep a list of people who might like to be in a group, and they ran through that and asked for referrals and got people into the groups. We had a very lively, wonderful discussions with the people. I would say there was a lot of variety in what happened to people, from very serious episodes where people nearly died to people who, again, look just like, or as Susan was saying when she was talking, who look very exemplary of the survey findings, which is they were just going along in their life and went to the doctor for something else, or thought, oh, gee, why am I so short of breath? Didn't think it was any big deal, and they end up with a diagnosis. So they were very much reflective of what we saw in the survey data. It was just what can I say? Sort of passionately felt. I mean, you really, when you're in the room with people who are telling you about their problems. The other thing that was interesting was that in the survey data, support groups don't really pop up as something that people are looking for, but in the focus groups, it was really interesting to see how much they bonded with each other and were so happy to talk to other people who had something that they shared. It was one of the more, I've done hundreds of focus groups over the last umpteen years, and these were some of the most bonded, friendliest people who were just really happy to meet other people who they could share with.
And then this is Sue Petchen again, I'm going to open it up for any additional questions. We did have one about some of the best first steps to approach local media to inform and plan for Heart Valve Disease Awareness Day in 2017. And this is coming from another heart valve ambassador with the AHA. we're going to be putting together some social media posts that you can use, tweets and Facebook posts, e-newsletter type of language to send emails out. So that'll all be available up on the agingresearch.org/valve disease page. And we're also going to be working with a number of partner organizations, including the American Heart Association, the ACC, the Association of Black Cardiologists, Mended Hearts, and others. A lot of the groups that signed on to the letter that you saw in the support slide and are up on the letter on our website. So those groups as well are going to be reaching out. So if you have specific interest, please again email us at info@agingresearch.org and check out the page at agingresearch.org/valve disease. And we would love to have you join us in the effort. Are there any other questions before we close the webcast? All right. Well, we're so happy that folks joined us today. This was a terrific program. Thanks to Nancy and to Susan for the time that she was able to be with us. And again, please check it out on the recording if you weren't able to hear the whole thing. And we look forward to keeping in touch. Thanks, everyone. Bye-bye.